Good afternoon, everyone, and welcome to Public Health Virtual Education Series Wažookį, Family Conversations. I'm Renelle, Public Health. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Please remember that our weekly schedule has changed to account for our summer block parties. So keep an eye out on Facebook, COB emails, and the Wažookį for our monthly schedule, and we hope to see you in person at our summer block parties. Today, we're happy to have Kandyce Dunlap, Director of Public Health, to discuss the Ho-Chunk Nation Department of Health Community Health Assessment and planning for the Community Health Improvement Plan. We'll have about 45 minutes for Kandyce's presentation, followed by a Q&A. Please use the chat function to enter any comments or questions for our presenter. I will monitor the chat throughout the presentation and read the questions for Kandyce at the end. You can also raise your hand and come off of mute during the Q&A to ask your questions out loud. Any questions that we don't have time for, we will forward on to Kandyce and then email responses back to the group. This session is being recorded and will be posted on the Department of Health website and Facebook page. Everyone, please welcome Kandyce.
Thank you. Hello. I'm going to take just 1 second and get this up. And so today I'm going to be talking about a little overview of our community health assessment or our tribal health assessment and go into the current phase of our community health improvement plan. So we're going to talk about the tribal health assessment, which is a review of our community's needs. We're going to talk about what a community health improvement plan, sometimes known as a CHIP, what the health department is currently doing, and then provide an opportunity for community input, both for those of us here in person and then afterwards being able to participate and vote online. And then at the end, we'll talk about some of our next steps. So our tribal health assessment started with community conversations last July through August 2024. There were 10 structured community listening sessions. From there, we worked within the health department to identify the themes that came from them, analyzing any of the community input, some of the recurring things that we heard in multiple different sessions. And from there, we've developed a report, kind of this comprehensive assessment, combining things from the community conversations and some secondary data sources. A community health improvement plan, or sometimes called a CHIP, is basically an approach to address these community level health problems in our service population. So the tribal health assessment or community health assessment identified some of those problems. And so this is the next step in looking at how do we go about addressing some of those. So we look at the assessment results, incorporating findings from our tribal health assessment, looking at setting some priorities for all of the different things that were developed. How do we prioritize which ones that need attention and focus first? Forming work groups to start addressing those, and then creating action plans, specific measurable strategies to help improve the health of communities. And it's important to note too that our CHIP or Community Health Improvement Plan also directly aligns with our health department's strategic plan. So this is a second step after our community health assessment or our tribal health assessment. And so where we're currently at in the health department is setting those priorities. We have the concerns and resources needed from the tribal health assessment. And before we can get to starting to implement some of those, we need to prioritize which of the themes we should start with. We want to get to all of them eventually, but understanding the kind of voting process in where to start with those. So we're gathering votes on what the health priorities were from those themes. We're doing active outreach at community events and through this platform to reach out all summer. So we started with Memorial Day and we'll go all the way through Labor Day, and ensuring that people's voices are heard in this process. So your input really helps shape our initiatives and resources. And so some of those main themes that came from the tribal health assessment, there are 5 main themes that were categorized. One of them is maneuvering systems. So how do we navigate the systems within the Department of Health, within the Ho-Chunk Nation as a whole, or with outside entities? Maneuvering or navigating. Mental health. How do we take care of people's mental health, spiritual health, and overall well-being? Connecting culture and health. Whether it's the health department connecting with culture, culture connecting with health, that interconnectedness of those, and utilizing storytelling. Communication and messaging. How are messages and communications coming out from the health department? How is the health department getting those? And that two-way type of communication. And then having access to healthy opportunities, whether it's your physical space, whether it's programs, services, etc. We're going to dive into each of these a little bit more in a few slides later, and there are some examples or definitions attached to each of them. So as we're going through and talking about some of these, think about these 5 things, and of these, which one of these do you think that the health department should be starting with? And if you're not able to participate virtually today, there is an option to vote online and participate. The QR code is here. You just open your camera on your phone, you tap on it, it'll scan the QR code, and you're able to vote online.